obstetricians that they have. And he was proudly talking about how they have robots now who are providing examinations for pregnant women. Yeah.
And who's controlling those robots? It's not some pervert at his house, huh?
Well, but the point is, if you're a patient, do you really want a robot examining you?
Right.
So, I mean, I think all of this, Theo, adds up to the fact, and I'll tell you, I've been all over the country, and wherever I go, I talk about this. Whether you're conservative, you're moderate, you're progressive, you understand the healthcare system is broken today.
Yeah.
We are spending, this is insane. Do you know how much we spend per capita? Add everything else, right? Medicaid, Medicare, what you pay out of your own pocket. How much do we spend per person on healthcare in the United States of America? Do you know? Take a wild and crazy guess.
Per year?
No, per person.
Oh.
Per person.
Okay.
$15,000 per person.
Okay.
So a family of four spends theoretically $60,000.
Oh, wow.
That is double what any other country on earth is spending. You got it?
Yeah.
You would think that if we are spending, if I buy a $100,000 car, you buy a $50,000 car, my car should be a little bit better than your car, right? And yet, despite all of those expenditures, our system is worse than others. We're the only major country not to guarantee health care to all people.
But it's because there's these kind of like darker agreements between hospitals and insurance companies, right? And the cost of drugs.
Yeah. It has to do essentially, look, in this day and age, running a healthcare system is very difficult. Technology changes. It ain't easy, I admit that. But what is the goal of a rational healthcare system? It is to say, first of all, to answer the fundamental question, is healthcare a human right? What do you think? Should everybody, regardless of income, get healthcare?
I believe that based on how much money our country has, I think it's wrong not to provide that to people because we waste it in so many other ways.
Okay, good point. So the issue here is, why is the wealthiest nation on earth, the United States of America, the only major country not to guarantee health care to all people? Okay? That to me is a fundamental issue. So today, despite spending so much money, 85 million Americans are uninsured or underinsured. And if Trump gets his way and throws another 15 million people off of Medicaid, raise that number to roughly 100 million. Okay? There are estimates out there that when you have that many people uninsured, no insurance, and underinsured means high deductibles, right? Mm-hmm. So if you got a high deductible, you may be insured. I've talked to people, I suspect you have, they had deductibles $10,000, $15,000 a year, right? Mm-hmm. So if you don't have any money, what the hell, how do you go to the doctor?
Yeah.
You can't. So you add all that together, people get sick, they can't go to the doctor. Some 50, 60,000 people die a year in America unnecessarily because they don't get to a doctor on time. That is pretty insane. So in my view, I push very hard to introduce the legislation of what we call Medicare for all, expanding Medicare to cover every man, woman, and child without out-of-pocket expenses. We could do that without spending, to your point, not a nickel more than we're currently spending.
Yeah. How can we get that move forward, though? Why does this just continue to be this thing, you know? Why does it continue to feel like nobody really wants to take care of us, you know?
Now you're getting into another issue.
Yeah.
All right, you want to go there?
I mean, yeah, I think we can go to a couple of these places.
All right, let's do it. All right, look, in one respect, the healthcare system is working extremely well. Not for ordinary people, not for you, not for me. It is working very well for the insurance companies who make zillions of dollars in profit, the drug companies who charge us the highest prices in the world for prescription drugs. And that's the function of the current healthcare system.
Right.
Okay. So again, running a healthcare system, whether it's in Canada, Europe, wherever it is, it ain't easy. And they all make mistakes. They all have problems. But if your goal is, if you and I sit down and say, okay, how do we provide a healthcare to all people? And how do we do it in a cost-effective way? All right? Will we come up with a perfect system? No. But that's our goal.
Right.
But if we sit here and say, okay, how can we charge the highest prices in the world for prescription drugs and make $38 billion next year?
Yeah.
How can we deny people the insurance that they paid for, right? Mm-hmm. The benefits that they paid for? That's a whole other scam. And that's the scam we're working on.
Yeah.
It is an effort to make huge profits for the drug companies and the insurance companies. And that's why we've got to end this broken system. And again, I will tell you, I've been all over this country. Nobody, or very few people, think this healthcare system is working. We got to expand Medicare over a 4-year period to cover every man, woman, and child.
But is there a real way to get there?
Yeah,
do you
there
think?
is. Look, the goal is, and then that takes us to another area. You ask the question, why? Why are we, perhaps the only country on earth not to guarantee health care to all people? Why have the Canadian, you're in Canada right now, I live 50 miles away from the border there. You get seriously ill, you're in the hospital for a month. You know what the bill is when you come out? 0.
Yeah.
Okay. And they spend half as much per person on health care.
And they have good posture too. You been over there?
Yeah, sure, of course. So the answer has a lot to do with who controls the United States and a corrupt campaign finance system, all right? So if I'm the insurance companies and if I'm the drug companies and you're running around and you're campaigning and say, I'm going to cut, as I do, we're going to cut prescription drug costs in half. We're going to guarantee health care to all people. What are you going to do? You're going to spend a whole lot of money on candidates